Children's Health says flu, RSV, and COVID are all on the rise this week. The respiratory viruses creating the most problems for children are RSV and the flu. Fox 4's Lori Brown has that story.
So the flu cases are skyrocketing at this point.
Dr. Carla Garcia Carreno, Director of Infection Prevention and Control at Children's Medical Center Plano, told us system-wide they saw 279 flu cases last week, a 93% increase from the week before. RSV and COVID cases are also on the rise. While adults usually recover from RSV on their own, Dr. Carreno says the virus can be dangerous for babies.
That if the baby is having any difficulty breathing, because the treatment for RSV is symptomatic, just hydration, taking down the fever, getting those secretions out of the nose. But if the babies start having difficulty breathing fast without fever, having retractions, having belly bleeding or head bobbing, or if they turn, either blue or purple, it's really important that you call 911.
And respiratory viruses can also cause babies to not drink milk, leading to dehydration. These are the signs to watch for.
They have less number of wet diapers. They are crying without tears. Their saliva is kind of thick. If their soft spot is sunken, those are signs of dehydration. You should also seek medical care as soon as possible.
Dr. Carreno said before things become an emergency, you should go to your primary care doctor who can test to find out which virus your child needs treatment for. Dr. Charles Dunlap is with Pediatric Associates of Dallas's Plano office.
How do you know if it's time to just wait it out at home or go in to see your primary care doctor?
Yeah, so it's easy. I think that decision is easier when you're talking about yourself personally as an adult, but when you're worried about your children, that's a whole different level of anxiety. And so what we tell our families is, look, if you're worried about your kid at all being sick and how sick they are, and you're not sure what to do, please just call us. We have an active staff of triage nurses that can give you guidance.
When it comes to the highly contagious flu, there is a treatment if diagnosed within 48 hours of a fever.
Your typical flu symptoms are going to be cough, headache, fever, usually above 100, maybe in the 102, 103 range, sore throat, body aches, chills, fatigue. You certainly can have wheezing, and some respiratory distress. And also it can be associated with nausea, vomiting, and diarrhea.
And if that sounds miserable, there is still time to get vaccines. The flu and COVID vaccines are recommended for everyone.
It's absolutely not too late, especially in a season like this where it's been delayed. I do think January and February will be worse than what we've seen.
The RSV vaccine or antibody treatment is available for babies and toddlers, pregnant women, and those over 60. Lori Brown, Fox 4 News.
Yeah, and Dr. Dunlap there said there's also a massive increase in what's being called the walking pneumonia right now because it's not as severe as a typical case. If your child has a cough for more than 2 weeks, experts recommend that they see their doctor.